everyone. We are the Laconia Smart Team. I'm Lindsay.
I'm Mitch.
I'm Brandon.
I'm Ashley.
I'm Noah.
I'm Daniel.
I'm Delaney.
First, we're going to start with some audience interaction. Please turn to your neighbor and introduce yourself. At this time, we would like you to gently poke or pinch your neighbor. Please be nice about it. Now, rate that level of pain on a scale from 1 to 10. 10 would be intolerable. What was your level of pain? Show of hands on a scale of 1 to 4, minimal pain. Show of hands 5 to 7, moderate pain. And 8 to 10, intolerable.
For you, it might not have been painful, but for people with hypersensitivity to touch, that would be excruciating. Billions of dollars are spent annually on people with chronic pain conditions. Some individuals may have hypersensitivity to gentle touch or normal limb movement, which is one of the most troublesome aspects of inflammatory pain. Pain is caused by the signals that are firing in the sensory neurons that can last for weeks, months, or even years.
The transcendent receptor potential arkin-1, or TRPA1, is the ion channel protein that is thought to regulate the neuron sensory process such as touch. TRPA1 is found in nerve membrane of humans. The protein has not been isolated, and researchers are currently trying to isolate TRPA1. Because TRPA1 has not been isolated, we modeled the homology model mechanosensitive channel of the large conductance, MSCL, which is found in the cell membrane of bacteria. So on the left is MSCL, which is the model that we modeled, which is the homology model of TRPA1, which is on the right. TRPA1, because they haven't isolated yet, that is a guess of what it looks like, but they know that MSCL is very similar to it, and they act the same.
Research has been done to show what happens to the ion channels with TRPA1 in mice to show pain withdrawal. This was done by using von Frey filaments. Von Frey filaments are used to test sensitivity by having different size filaments. The smaller filaments are generally harder to detect when used. However, the larger filaments, the stronger the effect it will have on the nerve. When Dr. Delaney uses the filaments on the non-inflamed mouse paw, even the larger filament doesn't cause a strong reaction. After Dr. Delaney inflames the paw, the reaction of the smaller filament is greater than any reaction from the non-inflamed paw. The skin nerves react greater when the paw is inflamed. Alright, and on the screen there is an example of an inflamed and uninflamed mouse paw.
In these nerve membranes, there are TRPA1 proteins that regulate the amount of sodium and calcium ions that pass through the TRPA1 when activated. When TRPA1 is behaving normally, it will allow sodium and calcium ions through the channel at a regulated pace. The PowerPoint shows the ions traveling through the channel. The balls that are being thrown represent the sodium and calcium ions. When the paw is inflamed, TRPA1 reacts abnormally and does not regulate the flow of ions, causing continuous nerve action. The research shows that when mice have hypersensitivity to touch, it causes TRPA1 to act abnormally. This is thought to be true in humans as well.
And then this data is from research done by our mentors. The graph shows the pain withdrawal threshold of the mouse at baseline. At baseline, the threshold was around 5, and when the paw was inflamed with the vehicle, the threshold dropped to around 1. Once the blocker drug that regulates TRPA1 was used, the threshold went back to baseline. The picture on the left shows the skin nerve fiber of a mouse paw. The nerve measures the response of sensory nerve terminals in the skin to stimuli. The graph on the right shows the action potentials of the paw. When the paw is uninflamed, the action potential is around 5 hertz with the 200 millinewton filament. Once the paw is inflamed, the action potential is around 13 hertz with the 200 millinewton filament. And after the blocker drug was used, the action potentials went back down to around 5 hertz with the 200 millinewton filament.
Okay, this is our model MSCL. The maroon amino acids create a constriction at the cytoplasmic surface. The teal amino acids are thought to play a role in the diameter of the channel pore. The navy amino acids help form a possible ligand binding site and
Good
could
morning.
potentially
Please stand
participate
for
in the
the flag.
ion conduction pathway.
I pledge allegiance to the flag.
The yellow amino acids are thought to possibly play a role in the in sensing membrane stretch.
Chronic pain can affect many people, such as veterans, elderly, little kids, or small children, and even the average person. Through the research, it is believed that protein TRPA1 is involved in many stages of chronic pain. Thousands of individuals have chronic pain. These are only a few examples of them. Chronic pain is not specific to one gender, race, or age. This can affect anyone. Remember the next time that you feel anything that is the TRPA1 ion channel working. We would like to thank
Our mentors Andy Wire and Kate Zappia from the Medical College.
Shannon Colton and Gina Bolton.
The CBM staff.
And MSOE.
Nicely done. Very good.